This bone tutorial is on the equine pelvis. So we're looking here at a bony specimen with the sacrum. So this is the sacrum here inside the pelvis. So we're going to take a look at the different parts of the equine pelvis. The different bones, so it's made up of different bones and they have different names for each of the parts. Here you will have the ilium. So the ilium has what's called a body here and a wing here. So this would be the wing of the ilium, this would be the body of the ilium. And that's on both sides, so you have that on right and left sides. Then the wing of the ilium, you'll have the tuber sacral, so up by the sacrum, so sacral, sacrum, goes up and points dorsally in the equine. So tuber sacral here and there. You have tuber coxae, which is here, so that's the protuberance here is tuber coxae. And then you have that on the other side as well. So here if I turn it and take a cranial, so you're looking at it from a cranial view here, and you have the sacrum is here, tuber sacral, those two there. Tuber coxae are off to the sides. So tuber coxae, tuber coxae. All right, so then we'll turn it back to the side view here. So the other part that you need to know from this view is the ischium. So ischium is going to be this part here. And you have an ischiatic spine right here. And then you have the tuber ischii. So tuber ischii is the protuberance caudally here on the ischium. And if I turn it to a caudal view, we'll be able to see the two of them. So tuber ischii and tuber ischii here. Then in between those two sides, you have this kind of archway in between, and it's called the ischial arch. So ischial arch in between the tuber ischii. So if we turn the specimen over, we're going to look at it from a ventral view. So I'm actually going to flip it over. And here you can see these holes. So you have a hole here, and you have a hole over here, and those are the obturator foramina. So obturator foramen, singular, obturator foramina for plural. But you have those two holes, so obturator foramen, you need to know that. And then you also have the pubis, which is going to be here. So this would be the pubis. Then we have in the hip joint, so where your femur would attach, we have the acetabulum. So here's the acetabulum here. This is the acetabular notch, this kind of divot right here. And you have that on both sides. Obviously you have two femurs and two legs, so they attach in these acetabulum. Here, an acetabular notch is there. Now we'll look at the pelvic inlet and the pelvic outlet, and we'll look at that on this bony specimen and then also again on the other specimen that I'll show you. So when you think of this in the animal's head would be pointing this direction, and the animal's tail is this direction. So the birth canal passes through the pelvic inlet and also the pelvic outlet. So here you would be inside the body in the animal's abdomen. So here inside the body, the fetus would pass through the pelvic inlet, which would be this opening here. So I'm inside the pelvis, but inside the animal here. And as I'm moving toward the outside world, so I'm moving out of the pelvic inlet, moving out through the pelvic outlet would be here, and then they're passed through into the outside world here. So then they're born. So pelvic inlet, and then pelvic outlet. All right, so we'll move over to a specimen that has some soft tissue still attached. It's ligamentous tissue. So here I have a similar specimen. It's an equine pelvis, but it still has the sacro-sciatic ligament. So that's this ligamentous tissue you see here. At least part of it. It has most of it attached. So here we have the ilium. Here we have the ischium. Down here is the acetabulum. Here is that sacro-sciatic ligament. And this is where we can appreciate the greater and lesser sciatic foramina. Foramina, plural. So one of them is a foramen. So greater sciatic foramen is the hole you see here. It's been enlarged due to just an artifact of drying the specimen. The hole is much bigger than it would be in life. But the greater sciatic foramen would be here. And then your lesser sciatic foramen is the smaller one, more caudally. So lesser sciatic foramen, greater sciatic foramen, sacrosciatic ligament. So then again, as we look at this as it would be in the animal, you would be inside the animal here, and as a fetus is passing through the birth canal, it then passes into the pelvic inlet here inside, and then passes out through the pelvic outlet. So out here would be the pelvic outlet. All right, so then we'll look at this from a little bit of a ventral view, because there's a couple things I want to show you on this specimen that we talked about in the dissection. But here, you actually have a piece of what is called the prepubic tendon. So here we're on the ventral side. You can see the obturator foramen here and an obturator foramen there. Here's the pubis. And we have the prepubic tendon. So attached to the pubis, prepubic tendon is right here. And you have the accessory ligament of the femoral head in the horse. So in an equine, you have this extra ligament that comes across and attaches to the prepubic tendon. So it's this piece right here running up and would attach to that femur, the head of the femur that would be right here. So accessory ligament. You also have a remnant of the ligament of the femoral head right here. So that's the one that holds it in the acetabulum. But the horse has this extra one, the accessory ligament of the femoral head. So also while we're looking at this acetabulum, we have the acetabular notch, which is right here where the probe is. And then across it, you have the transverse acetabular ligament right here. So that's kind of spanning across that notch in the bone. So one other thing I want to point out on this sacrum, so the sacrum is here in between the ilium, the wings of the ilium, I should say. And then I'm going to turn it cranially so that we can look at these. And the sacrum also has wings. So these are the wings of the sacrum here and here. So the wings of the sacrum, and those create a joint with the ilium, and that is the sacroiliac joint. So you have a sacroiliac joint here, and you have a sacroiliac joint here. So one on each side, but that's the joint between the sacrum, the wing of the sacrum, and the ilium.